Hello guys, so today I'm going to talk about the malignant tumors of bone. In my previous video I told you about the benign one. Here we're going to discuss the malignant one. So the tumors of bone are actually of three types: cartilage forming, bone forming, and those of the unknown origin. So the cartilage forming malignant bone tumor includes the chondrosarcoma, and bone forming malignant tumor includes the osteosarcoma, and those of the unknown origin includes the Ewing sarcoma. Before starting the chondrosarcoma, what are actually the causes of cancer in bone? Mostly the cancer in bone spreads through the metastasis. Metastasis from different cancer, but most importantly from the, here's the mnemonic, PBKTL, prostate, breast, kidney, testes, and lungs. So the cancer in bone mostly spreads from the mets of these cancers. Let's begin with the chondrosarcoma first. Chondrosarcoma is the malignant tumor that produces the cartilage. It actually affects male as twice as female, and usually it affects people of 40s or older. It arises in medulla of pelvis or central skeleton and can spread to invade the cortex and the periosteum. Unlike the benign one, it rarely spreads to the distal extremities, and more commonly, it arises in the axial skeleton, like the pelvis, shoulder, and the ribs. So let's begin with its pathogenesis. So the pathogenesis of chondrosarcoma is of it is divided into the sporadic cases and the multiple osteochondroma syndrome cases. So in the chondromatosis related or the sporadic cases, there is the mutation in the IDH1 and IDH2 genes, and those chondrosarcoma that arises from the multiple osteochondroma syndrome, there is the mutation in the XT gene. So I've already told you about the IDH1 and IDH2 gene and the XT gene in my previous video, but let me revise it. Let me give a quick revision of it. The IDH1 and IDH2 genes are actually those genes that encode for the enzyme isocitrate dehydrogenases, and mutations of these enzymes, it actually leads to the new enzymatic activity on the IDH proteins that lead to the synthesis of 2-hydroxyglutarate, and that 2-hydroxyglutarate interferes with the regulation of DNA methylation. So here is the thing that I actually explained you in my previous video, the IDH1 and the IDH2, and the mutations in the EXT gene, I've already told you about it, that there are two types of EXT1 and EXT2 genes. What these genes actually do, these genes encode the enzymes that synthesize the heparin sulfate glycosaminoglycans, and the reduced or the abnormal glycosaminoglycans, it prevents the normal diffusion of the hedgehog factor and leads to the disruption of the chondrocyte differentiation and the skeletal development. So I have already discussed about these two genes in my previous video. Just check it out. So the clinical presentation of a patient is that the patient presents with a painful, progressively enlarging masses. There are three grades of the tumor, from grade 1 to grade 3. The grade 1 tumor, they have a less cellularity, and the grade 3 have high cellularity, and it is more pleomorphic than the grade 1. And 70% of the grade 3 tumors, they spread hematogenously to the lungs. The histologic picture, it actually shows the cartilage that invades the marrow space, and it entraps the normal bony trabeculae. So this was all about the chondrosarcoma. Okay guys, so next is the osteosarcoma. Osteosarcoma is the malignant tumor that produces osteoid matrix or the mineralized bone. It has a bimodal age distribution, and by that it means like it has two peaks. One peak occurs at the 75% of the osteosarcoma occurs in the first peak, that occurs in the in persons less than 20 years of age, and the smaller second peak occurs in the older adults. Like it has kind of like two peaks. One peak occurs in the person less than 20 years of age, and the other in the older adults. So older adults who are actually suffering from the conditions like the Paget disease, bone infarcts, or previous radiations. It has one male to female ratio is 1.6:1, and the important thing in it is like its X-ray shows the sunburst pattern. The sunburst pattern, it actually represents the speculated osteoid with patches of the cortical destruction, And important thing that occurs in the osteosarcoma and Ewing sarcoma is the Codman triangle. It is not the pathognomic feature of these tumors, but it just indicates the aggressiveness. So what the Codman triangle is actually, the tumor breaks through the cortex and it raises the periosteum away from the bone, which actually leads to the calcification of the periosteum in the corner, and it forms a triangular opacity. So that is actually the Codman triangle, and it just indicates the aggressiveness of the tumor. So um, the patient presents with a pathologic fracture or bone pain with swelling. Okay, so pathogenesis of the osteosarcoma includes the germline mutations in the RB gene or the germline TP53 gene mutation, which is present in the syndrome called Li-Fraumeni syndrome. So these two conditions actually causes the osteosarcoma. The morphology shows a fine lace-like pattern of the neoplastic bone that is actually produced by the anaplastic malignant tumor cells in an osteosarcoma, and the aggressive neoplasms, they spread hematogenously to the lungs. Next is the Ewing sarcoma. Ewing sarcoma actually originates from the NAT. What is NAT? Neuroectodermal tumor. 80% are younger than 20 years of age, and male children are usually more affected as compared to the female. The Ewing sarcoma arises in the diaphysis of the long bone and causes pain and swelling. Ewing sarcoma actually starts in the medullary cavity and spreads to invade the cortex and the periosteum. Its pathogenesis or its cause is the translocation. Important thing here is the translocation. The translocation occurs of the EWSR1 gene that is present on the chromosome 22 to the FLI gene that is present on the chromosome 11. So the translocation occurs between these two genes, and EWS FLI fusion protein forms. This fusion protein then affects on the transcription, RNA splicing, and the cell cycle machinery. So this is basically the pathogenesis of the Ewing sarcoma. And the X-ray shows the moth-eaten appearance or the onion skin appearance. And why does it appear? It occurs due to small areas of lucency in the medullary cavity. And in the morphology, you can see the small round blue cell that resemble the lymphocytes. Like the other tumors in this group, it is also composed of the sheets of uniform small round cells that are actually more cohesive than the lymphocytes, and they have scant cytoplasm and may appear clear because they are rich in glycogen. One more important thing that is in its morphology is the homocyte rosettes. Homocyte rosettes are actually the round groupings of cells with a central fibrillary core, and it may present and indicate a greater degree of neuroectodermal differentiation.